Denise Brown is the Deputy Special Representative of the Secretary General in MINUSCA in Central African Republic. She's also the resident coordinator and the humanitarian coordinator. How is the pandemic being felt now in the Central African Republic, especially on the peace process that got started last year with a lot of challenges, a lot of some steps backwards?
It became the new crisis, the crisis within the crisis that we had to contend with, and it represents a huge burden for a country that is considered as the poorest on the planet, and which has huge population, over 600,000 people who are internally displaced. So that, you know, new dimensions that you're not dealing with in the rest of the world, the humanitarian situation now overlaid with the virus. So it's been extremely challenging, but I think we're learning as well, and there've been some positives also coming out of this new situation.
Would love to know if the pandemic has affected particularly some programs or some of the response, peace building responses of the UN.
Neither the mission nor the UN agencies have put a halt on any activities. We've done what we can with what we have. So all the peace building fund activities, that's going on. We've just adapted. We've adapted to a new way of working.
And can you give me a few examples of the way you've adapted activities to be able to carry on some of the work?
Masks. So we've got the UN agencies, the MINUSCA, the World Bank, everybody's producing masks because the population, again, poorest population on the planet. A mask costs less than $1. Most people can't afford that. So there's been huge efforts to produce masks locally and distribute them so that the activities can continue. Sensitization. So the work we're doing, whether it's on transhumance or with the local authorities or with the preparation for elections, we build in information on COVID. Use every opportunity we have to pass messages so that everybody in the country, everybody has the opportunity to understand what it represents and understand how to protect themselves.
Part of your strategy in terms of peace building has been to focus the attention on the borders, the border areas, on populations such as the displaced.
Absolutely, absolutely. Huge concern for the 600,000 internally displaced in the country. About half of them live in internally displaced camps where there is no possibility of social distancing. Access to water has been an issue. Access to soap. So the basic tools that people need to protect themselves, they haven't always had regular access. So we're putting a huge emphasis with the Ministry of Health and the World Health Organization on messaging in the camps, on ensuring that the water systems are working, ensuring that isolation centers are created, that there is medical personnel necessary in case of severe cases. So it's required another layer of investment to protect those people who are really the most vulnerable to mortality through the COVID.
How has the pandemic affected our operations and the UN's own capacity to provide support to accompany the Central Africans and the authorities in confronting this pandemic and carry on with the peace building work?
Already we had strong partnerships with the government. Those have been reinforced. It's like one big team, whether it's MINUSCA or the UN agencies, the Ministry of Health, the Ministry of Plan, Ministry of Humanitarian Affairs. It's, as I said at the beginning, the virus doesn't make a distinction. So this was the best motivation we had to ensure that we all work towards a common objective and that we use our existing resources to work more efficiently and effectively together. And I think we've seen that happening, a little bit painful and difficult sometimes, but now working very smoothly. You know, we were like in a prison here. no flights in or out, no way in or out, and faced this, you know, unseen silent enemy together was quite an extraordinary experience.
Well, thank you, Denise. I think it's quite, I guess, sobering to listen to you in terms of, you know, especially when we look back in March of when we were hit with the pandemic. But I'm also really encouraged to see all the work that's been done to adapt and to carry on, because there's no other other choice. But I really appreciate your time this morning, and really the hard work of the entire team in Bangui and across the country. So thank you so much. Really appreciate it.